Welcome to the Oncotarget YouTube channel. This interview is with Dr. Clementina Fon Tacer, currently at St. Jude's Research Hospital in Memphis, Tennessee. They are talking about their manuscript, published in Volume 7, Issue 3 of Oncotarget, titled γKlotho is a novel marker and cell survival factor in a subset of triple-negative breast cancer models, and is feasible for the treatment of canine malignant glioma patients.
Hi, my name is Clementina Fon Tacer, and I work at St. Jude Children's Research Hospital at the Department of Cell and Molecular Biology. Today, I will talk to you about our recent work published in Oncotarget, and this was actually done when we were still at Texas Southwestern Medical Center in Dallas, and was a joint effort of scientists from Texas Southwestern as well as from University of Ljubljana in Slovenia. And the first author is my graduate student, Nusha Trost. So we have discovered with our work that γKlotho is a novel marker and cell survival factor in a subset of triple-negative breast cancers. Breast cancer therapy is hugely improved last decades. However, triple-negative breast cancer still remains a challenging problem. This is the most aggressive form of the disease that very commonly affects younger patients and lacks molecularly driven treatments. As this disease is very diverse, we need to identify subgroups of triple-negative breast cancer patients with common molecular features that can be therapeutically targeted. And here we show that in contrast to Klotho and βKlotho, the third member of Klotho protein family, γKlotho, is overexpressed in more than 60% of triple-negative breast cancers. And it correlates with poorer disease progression and poorer prognosis. This came as a surprise to us, as the other two bona fide Klotho members, alpha and βKlotho, act as tumor suppressors and are often silenced in cancers. This is what we found also in our study. And these Klotho proteins have recently been discovered as co-receptors for endocrine fibroblast growth factors. These endocrine fibroblast growth factors act as the hormones, metabolic hormones, and it looks like that these Klotho proteins, by diverting FGF signaling towards metabolic regulation, divert FGFs from oncogenic functions, and that's why act as tumor suppressors. And this γKlotho, although it still binds to FGF receptors, we in our study clearly showed that it has exactly opposite function, in particularly in cancer cells. And it can promote cell growth when expressed, and it is required for cell viability in cells where it is expressed. It looks like that cancer cells become addicted to its function. When we depleted γKlotho from cancer cells, this led to cell cycle arrest and apoptosis due to increased oxidative stress in γKlotho depleted cells. Furthermore, we showed that when we overexpress γKlotho in cells that typically don't express γKlotho, this confers resistance to hydrogen peroxide, doxorubicins, to several means of oxidative stress, suggesting that γKlotho is part of antioxidant network in triple-negative tumors that enables these cancer cells to cope with increased oxidative environment and give these cells an advantage to survive under high reactive oxygen species conditions. It is known that cancer cells, in particularly in advanced stages of tumors, frequently exhibit high oxidative stress. And this suggests that this might be a good therapeutic target to pose additional pharmacological ROS insult. However, these cells do upregulate antioxidant capacity to adapt to this intrinsic oxidative stress, and this can cause drug resistance. So abrogation of these protective mechanisms could have a significant therapeutic implications. And our findings indicate that γKlotho might be a potential not only marker for patients of triple-negative breast cancer that might benefit from oxidative therapy, but also constitutes a novel drug target for these patients. We were very excited about our findings, and we are interested in figuring out the mechanistic details of γKlotho function in cancer cells, or even physiologically where it is normally expressed. But even more, the next angle we would like to pursue to try to use this as a therapeutic target and see whether or not targeting γKlotho might really help us develop new strategies for targeting triple-negative breast cancers.
Oncotarget was launched in 2010 as a traditional peer-reviewed journal with free access that focused primarily on cancer research. Currently, Oncotarget is a multidisciplinary journal which publishes in weekly issues and is covering topics beyond oncology, in fields such as neuroscience, immunology, pathology, and more. You can click on the link in the description below to order a reprint or read the manuscript that was discussed in this interview on Oncotarget.com. Please feel free to subscribe to our YouTube channel and connect with us on Facebook, Twitter, or LinkedIn. Thank you.